TMJ dysfunctions, dislocation management, open-closed reduction. TMJ luxation, reduction without under anesthesia. TMJ fixation. TMJ open procedures, arthrotomy, condyloplasty, condylotomy, condylectomy, aminoplasty. TMJ open procedures, recontour of glenoid fossa. TMJ open procedures, meniscectomy. TMJ open procedures, plication, repairs, replacement of meniscus, grafting. TMJ arthrotomy for major reconstruction, fossa replacement, condylar replacement, gap arthroplasty for ankylosis, grafting. TMJ arthroscopic examination and diagnosis. TMJ arthroscopy biopsy. TMJ arthroscopy removal of loose bodies. TMJ arthroscopy lavage. TMJ arthroscopy lasis of adhesions. TMJ arthroscopy synevectomy. TMJ arthroscopy condyloplasty. TMJ arthroscopy aminoplasty. TMJ arthroscopy recontour of glenoid fossa. TMJ arthroscopy meniscectomy, plication of meniscus, repair of meniscus. TMJ arthrocentesis, puncture and aspiration. TMJ injection with anti-inflammatory drugs, sclerosing agent. TMJ appliance splints, orthodontic rehabilitation, post-operative. Salivary glands, treatment of salivary duct, dilation of. Salivary glands, salivary duct, insertion of polyethylene tube. Salivary glands and ducts, sialoductoplasty. Salivary glands and ducts, reconstruction of. Salivary duct, sialolithotomy, anterior canal, posterior canal. Salivary gland, excision of submaxillary gland, sublingual gland, mucosal ranula. Salivary gland, excisions, marsupialization of ranula. Salivary gland, removal, parotid, subtotal. Salivary gland, removal, parotid, radical, including facial nerve. Neurological disturbances, treatment of trigeminal nerve, avulsion at periphery. Neurological disturbances, treatment of trigeminal nerve, total avulsion of a branch. Neurological disturbances, treatment of trigeminal nerve, total alcoholization of a branch. Neurological disturbances, treatment of trigeminal nerve, infiltration of a branch for diagnosis. Neurological disturbances, trigeminal nerve, intraoperative, diagnosis or physiologic monitoring, stimulation with recording evoked potentials, ultrasound or impedance. Neurological disturbances, trigeminal nerve, neurolysis or tumor excision of trigeminal nerve branch in soft tissue, bone, not to include osteotomy. Neurological disturbances, mental nerve, transportation. Neurological disturbances, mental nerve, decompression in canal. Neurological disturbances, inferior dental nerve, complete avulsion. Neurological disturbances, inferior dental nerve, decompression in the canal. Neurological disturbances, surgery, injured nerve repair, primary, secondary, when repair delayed more than 4 weeks. Neurological disturbances, surgery, neural transposition and decompression. Neurological disturbances, surgery, implantation of electrode for peripheral nerve stimulation. Neurological disturbances, surgery, excision of tumor or neuroma. Neurological disturbances, surgery, nerve repair with graft. Neurological disturbances, surgery, harvesting of nerve graft. Neurological disturbances, surgery, epidural suture of trigeminal nerve branch per anastomosis. Neurological disturbances, surgery, fascicular suture of trigeminal nerve branch per anastomosis. Neurological disturbances, inferior dental nerve, complete avulsion. Neurological disturbances, surgery, conduit implant for repair of nerve gap. Neurological disturbances, surgery, fibrin adhesive per anastomosis. Neurological disturbances, surgery, laser coagulation per nerve anastomosis. Neurological disturbances, surgery, procedures when using operating microscope. Antral surgery, immediate recovery of a dental root or foreign body from the antrum. Antral surgery, immediate closure of antrum by another dental surgeon. Antral surgery, delayed recovery of dental root with oral enterostomy. Antral surgery with nasal enterostomy. Antral surgery, lavage, oral nasal approach. Antral surgery, oroantral fistula closure, same session with buccal flap, gold plate, palatal flap. Antral surgery, oroantral fistula closure, same subsequent session with buccal flap, gold plate, palatal flap. Sinus osseous augmentation, open lateral, indirect inferior, autograft, allograft, xenograft. Hemorrhage control, primary, secondary hemorrhage. Hemorrhage control, using compression and hemostatic agent. Hemorrhage control, using hemostatic substance and sutures, including removal of bony tissue, if necessary. Grafts, surgical, harvesting of intraoral tissue for grafting to operative site, bone, cartilage, skin, mucosa, fascia, muscle, dermis. Grafts, surgical, harvesting of extraoral tissue for grafting to operative site, to include ileum, rib, bone, costochondral, cartilage, skin, mucosa, fascia, muscle, nerve, dermis. Grafts, surgical, vascularized tissue flaps, free, attached microanastomosis. Harvesting and preparation of platelet-rich plasma fibrin. Delivery of growth factors, autologous, allogenic, human recombinant. Post-surgical care, subsequent to initial post-surgical treatment, minor, major, by treating dentist. Post-surgical care, minor, major, by other than treating dentist. Post-surgical care, alveolitis, treatment of, without with anesthesia. Emergency office procedures, tracheotomy, cricothyroidotomy. Muscular disorders, treatment of muscular dysfunctions. Implantology includes placement of implant, post-surgical care, uncovering and placement of attachment, but not prosthesis. Implants, surgical installation of implant with cover screw, with healing transmucosal element, with spinal transmucosal element. Implants, surgical re-entry, removal of healing screw, placement of healing transmucosal element. Antral surgery, oroantral fistula closure, same session with buccal flap, gold plate, palatal flap. Implants, surgical re-entry, removal of healing screw, placement of final standard custom transmucosal element. Implants, surgical installation. Implants, installation of provisional implant. Implants, removal of provisional implant. Implants, removal, uncomplicated, complicated.